Hey everyone, welcome back to the channel. Today, we're going to talk about Sheehan syndrome, a condition that mainly affects women after childbirth. Sheehan syndrome is a form of postpartum hypopituitarism, which means the pituitary gland fails to work properly after delivery. The pituitary gland is often called the master gland of the body because it controls many other hormones. When it's damaged, the effects are widespread and serious. This condition is rare in countries with good obstetric care, but still very important to recognize because it can be life-threatening if missed. The main cause of Sheehan syndrome is severe postpartum hemorrhage, meaning massive blood loss during or after childbirth. During pregnancy, the pituitary gland becomes larger and needs more blood supply. If a woman experiences heavy bleeding and severe low blood pressure, the pituitary does not get enough oxygen. This lack of blood flow leads to ischemic damage and death of pituitary tissue. So the key idea here is simple. Massive bleeding, low blood pressure, pituitary infarction. Let's understand what happens inside the body. During pregnancy, the pituitary gland enlarges, but its blood supply does not increase proportionally. This makes it vulnerable. When severe hypotension occurs, the pituitary suffers ischemic necrosis, meaning the tissue dies because of lack of oxygen. Once pituitary cells die, hormone production permanently decreases. This damage is usually irreversible, which is why Sheehan syndrome causes lifelong problems if untreated. The pituitary controls many essential hormones, and in Sheehan syndrome, several of them are lost. Low prolactin causes failure to lactate. Low ACTH leads to cortisol deficiency, which can be life-threatening. Low TSH causes hypothyroidism. Low LH and FSH leads to amenorrhea and infertility. Low growth hormone contributes to fatigue and poor quality of life. This wide hormonal failure explains why symptoms can appear gradually and seem confusing at first. The symptoms of Sheehan syndrome may appear immediately or years later. One of the earliest signs is failure to breastfeed after delivery. Other common symptoms include amenorrhea or infertility, severe fatigue and weakness, low blood pressure, cold intolerance, weight gain, depression, or mental fog. Because symptoms develop slowly, many women are misdiagnosed for years. Diagnosis starts with a careful history. Any woman with a history of severe postpartum hemorrhage and unexplained hormonal symptoms should raise suspicion. Blood tests show low pituitary hormones and low target gland hormones. MRI imaging often shows an empty cella, which indicates pituitary atrophy. Early diagnosis is critical, especially to prevent adrenal crisis. Sheehan syndrome requires lifelong hormone replacement therapy. The most important rule is this. Glucocorticoids must be given first, before thyroid hormones, to avoid adrenal crisis. After that, thyroid hormone, estrogen, progesterone, and sometimes growth hormone are replaced. With proper treatment, patients can live normal, healthy lives. The prognosis of Sheehan syndrome is generally good if diagnosed early and treated properly. However, delayed diagnosis can lead to serious complications, including adrenal crisis and even death. Thanks for watching. If this video intrigued you, don't forget to like, subscribe, and join me next time as we uncover more mysterious medicine. See you next time.